reports this morning from several healthcare industry players. Cigna beating estimates, posting adjusted earnings per share of 49 cents for its fourth quarter. Cardinal Health just announced it earned an adjusted 93 cents a share, beating the street at 89 cents. And IMS Health was in line, reporting 50 cents a share. Well, the health sector is watching how the stimulus plan is moving through Congress as part of that record $900 billion plan. Approximately $127 billion of it has been proposed in federal health care spending as part of the recovery package. And while yesterday President Obama signed the S-CHIP bill expanding health care to 4 million uninsured children, the president's promise to rapidly revamp the U.S. health care system has been delayed by the stimulus battle and the withdrawal of Tom Daschle as Health and Human Services Secretary. For more on how these issues are affecting President Obama's plans, Jeff Miles, a president of Health Care Analyst who served as a member of the 2008 Presidential Candidates Health Care Platforms, joins us. Sarah Rosenbaum is the chair of the Department of Health Policy at George Washington University School of Medicine, and Matt McCall is the president of Penn Financial Group. Good morning, all of you. Thanks for being here. Matt, just at first glance, we saw, as we mentioned, Cigna, Cardinal Health, IMS, looks like across the board pretty much meeting or slightly exceeding expectations. What do you make of the numbers? You know,
in this type of market environment, Alexis, I think that's good. I mean, if we can meet earnings, it's going to be very important what type of guidance they give or if they even give guidance, because we've seen a lot of companies recently pull back guidance. So that's going to be very important. But so far, just looking at the top line numbers, things look actually fairly good. The healthcare companies, they look as a defensive sector in a recession. However, a lot of healthcare companies haven't held up very well. The healthcare plans are one of the few sectors that have held up well. So I'd like to see how Cardinal Health reacts after the numbers this morning.
All right, Jeff, you know, we mentioned here at the top here that the president signed yesterday the S-CHIP bill to make sure that more children in this country have health care insurance. What might this mean for his health care plan? And walk me through the costs, because that's a little bit of the controversy, at least coming out of the Republican Party this morning.
Yeah, good morning, Alexis. It's good to be with you again. You know, the problem with the S-CHIP, and I want to just make it clear, I'm a big supporter of the S-CHIP program as it was originally intended and created. The problem is that this expansion of S-CHIP is not just about children. This S-CHIP program that was reauthorized yesterday includes the option for children of families that make as much as $66,000 a year to be able to transition their health care out of the private sector and into the public sector, which is merely going to mean more federal dollars that's going to have to be picked up, state dollars as well, because the S-CHIP is a jointly funded program. How it affects the future of President Obama's health care ambitions is yet to be seen, but it is going to move a large number of people to the government roles, and frankly, I don't know where we're going to get the money to pay for it.
Yeah, I mean, Sarah, I would imagine that that is sort of the first step that's going to lead to this question about universal health care and government intervention in the health care process, or the government footing the bill, I guess calling the shots. Where are we headed now that Tom Daschle, we know he's not going to be the Secretary of Health and Human Services. We don't know yet who he's going to select, but where are we headed, at least at this stage in the game?
Well, first of all, let me note that the bill does nothing of the sort as it was just described. It's a tightly targeted bill. The overwhelming proportion of children assisted are the poorest children in the country, and the bill has a very limited effect on so-called health insurance crowd-out. In terms of where we're headed long-term, the measure represents an important down payment on universal coverage for children, with an expansion, of course, to a mechanism to cover all families who need assistance. The kind of plans under consideration are plans that would in fact expand purchasing power for private health insurance, not supplant private health insurance with a public system. I am confident that that plan will proceed forward rigorously. It is something that the voters want badly. It is something that the president is very committed to.
Jeff, I see you smiling. I know you did not support Tom Daschle's plan. That's the plan that many suspected the president would put in order. What is it that you were concerned about, and where do you want to see changes now, since we're so early in the game?
Well, you know, the problem really is that healthcare is a very complicated issue. Most people don't really have a full grip on it. If you were to read Tom Daschle's book and look at what his opinions are about how we fix healthcare, the number one thing he was for was centralized command and control by the U.S. government, dictating to doctors and patients exactly how they're going to be allowed to render and receive care. That's a bad idea. Whether or not it's all being funded in the public sector or not, if you affect the private sector that way and affect the doctor-patient relationship that way, you're going to end up ultimately with a central command plan that's ultimately going to lead to a complete crowd out of private insurance. That was the intent of Daschle's plan. He says so in his book. What they were going to do initially.
Right. Matt, who does this impact? I mean, look, I imagine that the major drug makers are not going to be thrilled because we're going to see more generics. We're going to see more prevention, cost cutting. Who's a winner, who's a loser?
The winners obviously are going to be the more generics and biotech, because you're going to be looking for the next big drug out there. The major pharmaceuticals right now don't have very good pipelines, so you're going to see a lot of consolidation, then picking up some of the biotech companies. The other big winner that I'm really looking at for my clients is going to be the healthcare IT. I think whether the stimulus package goes through or not, there's going to be billions spent on that IT. Obama's talked about in his campaign, and he continues to talk about that. Losers, I think there's going to be some healthcare plans that really fall by the wayside, but in the same sense, there's going to be a couple of healthcare plans I think that make it. So it's going to be very tough for investors in that healthcare area that you have to be company specific and do a lot of research. It's going to be tough to make money in healthcare.
Sarah, who would you like to see replace Tom Daschle as the leading candidate for the role?
I think if the president selects any number of individuals who are under consideration at this point as the leading voice for health reform, that's fine. I actually think the president is his own best leading voice for health reform. I think he is ably staffed in the White House, and whether or not he ever does choose a new health czar, if you will, it really is not going to affect in the long run our ability to put health reform into place.
And Sarah, before we go here, a lot has been made about what he could accomplish in his first 100 days in office. Obviously, this has set him back slightly, but do you view the change that's required in healthcare as a multi-year, perhaps even as much as 2 to 4 year process before we can really see the changes work their way through the system?
Oh, yes, I think it's entirely possible to pass legislation within the first year that would put the entire health reform architecture into place. I think it will be multiple years before a reform system is fully phased in.
All right, Jeff, Sarah, and Matt, thank you guys very much. Great conversation.